Okay, good afternoon, everyone, and thank you so much for joining us for this webinar that we have hosted for today, which is on burnout in the amongst healthcare workers. We've got hopefully a very enlightened panel this afternoon that will discuss different aspects of this issue, and we would like to say thank you to UKZN for organizing this platform, and we're looking forward to sharing these ideas and listening to all of you having questions, and we can hopefully try and answer them. So this afternoon we'll be talking about burnout, and I think most of us have really been acutely aware of burnout amongst healthcare workers, amongst nurses, amongst doctors, amongst everyone really in the healthcare profession, particularly in the last year or so because of the COVID-19 pandemic. But I think some of us have been aware of this for a while. It's really becoming an increasing issue that has been highlighted, particularly amongst doctors and nurses in the front lines, so-called front lines of our healthcare system. So what we're going to do this afternoon is just perhaps begin with a little bit of definitions, try and break it down, what we mean by this. We'll chat a little bit about how common this is amongst doctors and nurses and other healthcare professionals where there's data to show. And then we will talk a little bit about some of the work that we've done in KZN, in KwaZulu-Natal, at UKZN, and across South Africa that has tried to improve the state of the mental health care of our frontline workers in particular. And then we'll also then chat at the end a little bit about what some of the things that you can do yourself as a healthcare worker, and also what we should be doing as a whole in terms of the system to try and make sure that we decrease the rates of burnout, depression, and anxiety. So my name is Professor Bonga Chidiza. I'm the head of Department of Psychiatry at UKZN, and I'd just like to first introduce you to the panel. And we have 4 psychiatrists on our panel this afternoon, and 4 senior psychiatrists from the department. And the first person that will start our discussions is Dr. Saida Paruk. Dr. Saida Paruk is a child psychiatrist based at King Dinizulu Hospital and within the Department of Psychiatry. And she'll be the one that will take us through some of the definitions a little bit earlier. And then we've got Professor Suvira Ramlal. Professor Ramlal is one of the senior psychiatrists in our department. She is also at King Dinizulu Hospital and is involved with a large part of medical training as well within our faculty. Good afternoon, Suvira. And lastly, we're going to hear from Dr. Pete Milligan. Dr. Pete Milligan is also a psychiatrist in our department. He's a senior member of our department. He's the head of clinical department of psychiatry at UKZN Hospital, and in that region up in KwaZulu-Natal, in the rural area of KwaZulu-Natal. And so he'll be sharing with us a little bit about his experiences and what can be done about this whole issue of burnout. Afternoon, Pete.
Hi, afternoon, Prof. Thank you.
So without further ado, then I'm going to start with you, Saida. If you could perhaps just take us through what are some of the definitions of what it is that we're talking about, perhaps how common this is, and then we can just kind of, all of us have similar sort of, hopefully, similar kind of thinking about what it is that we want to discuss this afternoon. Over to you, Saida. And you are muted.
Thank you, Prof. Lisa, and thanks to everyone for joining this seminar today. I'm going to share my screen just so that we can go through the definitions. So the COVID-19 pandemic has posed an unprecedented challenge to the physical and mental health of people globally, including to the health of healthcare workers. From our experiences of previous epidemics, we realize that healthcare workers will face significant challenges in terms of anxiety, psychological distress, fear of the infection, fear of the unknown in managing a new and severe disease, and trauma from seeing patients suffer, family members becoming ill, and the trauma of losing patients during these very challenging times. All this can also be further exacerbated by the fact that many of our healthcare workers work in very low resource settings, which are often characterized with staff shortages and poor support, long hours, and heavy patient loads. So bearing this in mind, we thought it's critical that we understand what burnout means, how burnout, depression, and anxiety can be interlinked, and how common are these conditions in our setting. So burnout is a psychological syndrome which occurs in response to chronic stresses on the job. It is a constellation of symptoms in 3 areas that mainly include emotional exhaustion, depersonalization, and a loss of perspective that work is still meaningful. When a person is described as being burnt out, it tends to develop symptoms of emotional and physical exhaustion, negative feelings about his job, feelings of detachment, and a feeling of being not achieving anything at work. Burnout is often caused by individual organizational factors which are work-related. And obviously work-related factors may be significantly exacerbated during a pandemic, such as our recent COVID-19 experience. So signs of burnout will include headaches, muscle tension, trouble sleeping, feeling overwhelmed and cynical, frustrated, not wanting to go back to work, becoming irritable, becoming apathetic and negative. How common is burnout? Prior to the COVID pandemic, data from South Africa suggested that there were high prevalence rates of burnout in healthcare workers anyway. And studies showed prevalence rates between 0 to 80%, with one study in the Western Cape of junior doctors reporting 100% prevalence of burnout amongst their doctors. A recent study in KwaZulu-Natal of doctors working in state hospitals in the Tigweni area reported a 59% prevalence of burnout. And in a recent systematic review which assessed the burnout literature from Africa, 46% of nurses in South Africa reported burnout. So burnout has always been highly prevalent in our setting. And during the COVID-19 pandemic, surveys have reported even higher rates of burnout, with many studies suggesting a prevalence rate of around 40% amongst all healthcare workers. And when we speak about healthcare workers, we're referring to not only doctors and nurses, but to all our para-allied staff and team, including pharmacology, psychology, physiotherapy, technicians, etc. Unfortunately, there isn't really good data on the current COVID pandemic and burnout in healthcare workers in South Africa, as most studies done recently have measured psychological distress, anxiety, and depression. But I think at the end of the day, what we're saying is that burnout has been highly prevalent, and we expect that the rates are much higher now during the pandemic. 2 mental health disorders are also very common, anxiety disorders and depression. And hence, we wanted to just also focus a little bit on these 2 disorders today. Anxiety disorders are generally disorders in which there's a characteristic feeling of being stressed, associated with fear, worry, unease. And often these feelings are accompanied by symptoms such as being fatigued, restless, complaining of palpitations, sweating, and other somatic complaints that are often severe and persistent enough to impact on functioning and then would be considered a disorder. In South Africa, a study of the general population had reported a 15.8% prevalence of anxiety disorders in adults. And this suggests that it's one of the most common disorders in the South African general population. In this recent study that looked at state doctors in KwaZulu-Natal, we found a 20% prevalence of anxiety disorders in these doctors, which again suggested that they have a higher rate of anxiety disorders than the general population. During the COVID pandemic in the past year, studies have suggested that anxiety disorders in healthcare workers has escalated, and a systematic review by Robertson et al. Suggested prevalence rate of anxiety disorders between 10 to 44%, which is quite high approximately almost a half of all healthcare workers are anxious. Another study suggested a prevalence rate of 25.8% on average of anxiety amongst healthcare workers. So again, suggesting that healthcare workers have been, either through the COVID pandemic directly or due to other factors associated with this pandemic and lockdown experienced high levels of anxiety. Another common disorder is depression. Depression is a mood disorder associated with low mood or irritable mood, loss of interest, guilt, worthlessness, sleep and appetite changes, decreased energy and concentration. And again, if the symptoms are persistent and severe enough to affect functioning, we would consider it to be pathological. The general population prevalence rates for major depressive disorder is around 9.8%. And what is startling that even in the pre-COVID survey of doctors in KwaZulu-Natal, we reported a 21% prevalence of symptoms amongst doctors in KwaZulu-Natal. Internationally, surveys currently during the COVID pandemic suggest rates between 80 to 50% of major depression in healthcare workers. Again, this is really concerning because the rates are really suggesting that healthcare workers are struggling to cope. One other concept that I wanted to very briefly and quickly introduce was grief. Grief is something that we experience every time we have a loss. We have grief. Grief is a normal reaction to a significant loss, and may be due to primary losses such as death of a loved one or a patient, but may also be due to other losses such as the loss of relationships, recreation, social support, economic stability, etc., which have come with the COVID pandemic. And healthcare workers similarly are not isolated from these kind of losses and may also be experiencing grief. So I think what we're trying to illustrate is that possibly healthcare workers may be experiencing high levels of burnout, anxiety, depression, and may also be grieving during this process. Why is it important that we look at these concepts? Because if they are untreated, undetected, and not recognized, mental health and burnout problems can erode professional behavior at work and relationships at home. It can result in mental illnesses such as substance use, depression, anxiety, and an increased risk of suicide. Burnout may also lead to decreased empathy and compassion, poor communication, and hence more negative patient outcomes individually for patients, and also for an institution, productivity and the ability of a doctor or a healthcare worker to provide care for the patients may be significantly impacted on. Hence, we recognize that burnout and mental health disorders are often interconnected, and if untreated, may result in negative consequences for the individual, for the patient, and the institution. However, in conclusion, I'd like to say that while the COVID pandemic has brought along all these challenges for our healthcare workers, we also have shown during this period to have remarkable resilience. And our healthcare workers have served our country with major courage and major sacrifices during this time. So I think it's time that we now start serving them by looking after their health as well. So I think that basically sums up what burnout, depression, and anxiety are, and attempts to illustrate how common these problems are. Prof. Kaliza?
Yeah, thank you. Thank you very much, Seda. I just wanted to, just one point of clarity. So when you talk about these rates, so for example, you said 20% of doctors are depressed. Are you saying that at any one time, like 1 out of every 5 doctors that are working in Durban at that particular time actually have this thing called depression?
So the survey tool that we used in the KwaZulu-Natal study looked at current depressive symptoms in the past 2 weeks. So this would be doctors reporting on their current depressive symptoms.
So not a lifelong, so not at some
lifetime.
stage of their life. So at this particular time, sure, that's very high. And also there's one more thing I wanted to ask you. You mentioned the word trauma, and that's one of the things that I find a lot of my patients say they don't understand what that means. Maybe do you just want to, what do we understand by this word trauma that you've mentioned, which is, I think, is important as well?
So I think when we discuss trauma in psychiatry, we're looking at negative or experiences that are unpleasant or may have caused trauma, not necessarily only physically, but they may also be emotional, they may be neglect, they could be abuse. So when we speak of we use a broad term or umbrella term of trauma, we're referring to any negative life event that may have occurred. And also we know that different life events impact on different people differently. So what may be considered traumatic for someone may not necessarily be as traumatic for somebody else.
Sure. So including horrible things.
Yes. And sometimes it's not just necessarily one event, but it may be a series of small events that together become traumatic for an individual.
Sure. So thank you so much, Seda. If you can stay on for a little bit, I'm sure there'll be questions in the Q&A. But let's move on swiftly now to Professor Suvira Ramlal. Suvira, can you chat to us a little bit about some of the psychosocial interventions that we've tried to put in place during this time, and perhaps also some of the work that you have been involved with in the healthcare workers care network that you've been involved with? Thank you.
Okay, thank you, Dr. Lisa, and thank you to the UKZN team for putting this together, and welcome to all our attendees. So I just want to say that I am actually very honored to play a very small role in the Healthcare Workers Care Network, but I think it's important to share information about that in view of the work, the sterling work that they are doing. This is an initiative launched to provide caring, support, and resources for the carers, by the carers, and to build a support platform for the mental well-being of healthcare workers in South Africa. This network grew from an initiative of a group of about 14 public and private sector psychiatrists and psychologists in Gauteng in March last year, in the wake of the COVID pandemic. And I'm not going to single out names because I think all 14 of them deserve credit for their vision, their drive, their passion, their compassion, and their selflessness. But I want to emphasize that these are all frontline workers themselves who sacrificed their time and effort while managing their clinical duties and personal and family needs during the pandemic. So by June of last year, they had expanded this initiative into a national network in collaboration with the South African Depression and Anxiety Group, the South African Society of Psychiatrists, the South African Society of Anesthesiologists, the South African Medical Association, and the Psychological Society of South Africa. And with the benefit of private funding, they were able to set up a very impressive website of resources, as well as a 24-hour helpline for frontline workers to access emotional support and assistance. In terms of the platform itself, they have a prevention arm, which is dedicated to conducting lectures and training workshops for leaders and managers in the health sector, who in turn can support their members and staff. And to this end, they and later the provincial coordinators have conducted multiple webinars and training workshops on various aspects of healthcare workers' well-being during the different phases of the pandemic that we've been through. The other arm is the reactive arm, and it's the treatment and response component involving direct free therapy for healthcare workers. And it includes access to individual sessions, group sessions, and a toll-free helpline. During the course of the pandemic, provincial hubs have been established, and that is how I got involved, together with Santosh Pillay, who's a clinical psychologist from King Dinizulu Hospital Complex, as well as Dr. Hemant Novath, who's a psychiatrist in the private sector. And together we assist in connecting healthcare workers from KZN who reach out for help with other mental health care practitioners who have volunteered to offer up to 4 free sessions of therapy per healthcare worker. Now, these are also helpline volunteers. There are also helpline volunteers who follow up on those who contact us. And currently there are over 500 mental health care practitioners throughout the country who have volunteered their services pro bono just to support our healthcare workers. And since its launch, the Healthcare Workers Network has received over 1,000 calls, 200 SMSs. They've had close to 4,500 attendees at their training sessions. and had close to 300 self-referrals for therapy or counseling. And this translates into close to 400 hours of free professional help in total. So it is encouraging that 64% of the healthcare workers who contacted us during this period attended at least one counseling session. I want to emphasize, though, that the vision for the Healthcare Workers Network platform is noteworthy, especially in light of the figures and the worrying data that Dr. Parak has shared. I've chatted with a few of the founding members, psychiatrists, Dr. Antoinette Merrick, Dr. Triya Rameser, and anesthesiologist Dr. Caroline Lee. And I was happy to learn that their plans actually antedated the pandemic and that this platform had been in the pipeline in response to the unacceptably high levels of stress and distress among healthcare workers, as spoken about by Dr. Parak. And I want to emphasize that this is not a local phenomenon, it's a global phenomenon where healthcare workers throughout the world are under high levels of stress and distress. A wealth of resources related to healthcare workers' well-being is freely available to all on this website. There are informative articles, videos, podcasts, research articles, and webinars. So I encourage all to visit the website and make use of these very useful resources as a starting point to addressing our mental well-being needs. I will post the website, the 24-hour helpline, and the SMS details in the chat, as well as for those in KZN wanting help, they can contact us by email directly on care4kzn@gmail.com. And either Santosh or I will link to the therapist you provide us with a few of your contact details. Now, I'm sure you would want to know what has been the response to this national initiative. Now, given the magnitude of the emotional impact of the pandemic on every single person across the globe, our concern initially was that our mental health care practitioner volunteers would be overwhelmed by requests for help. Surprisingly, the converse has been true. In KwaZulu-Natal, we have had no more than 30 requests for assistance from May last year until this last weekend. Several of these declined support when contacted. A few had secured help since contacting us. And in a few instances, there were requests for interventions for groups affected at public healthcare facilities. Now, unfortunately, travel to these sites was not possible due to lockdown. And sadly, these facilities, like most healthcare facilities in KwaZulu-Natal, have no Wi-Fi to enable webinars or online therapy. So I've been struggling to understand why the uptake has been so low, given that it's free therapy during a time of such high levels of mental distress and stress. And there could be several possible reasons. Firstly, those with medical aid may have accessed care privately, and fortunately, medical aids have permitted teleconsultations during lockdown. Secondly, there were several professional and non-governmental groups that offered parallel support services. So I'm hoping that healthcare workers that were in distress avail themselves of these opportunities. Thirdly, we have experienced much variability across institutions in KZN with respect to the sharing and distribution of information and access to resources. So I do think that communication, both during and before the pandemic, can be greatly improved in our healthcare institutions. The quality of leadership and availability of resources within institutions also impacted on the support that healthcare workers received. And we also must bear in mind that many leaders themselves are vulnerable and poorly trained in mental health matters. And they were also personally affected by the pandemic. And fourthly, despite these, I do believe that there remains a reluctance in general for people, including healthcare workers, to access mental health services. Dr. Dawood, one of our psychiatry registrars, conducted a survey amongst KZN doctors and nurses during the pandemic last year, and we found high levels of depression, anxiety, stress, and trauma. Yet, almost 75% of those participants felt they were unsupported by their employer, even though 90% stated that they did have access to support from EAP and the occupational health clinics in their institutions. So while stigma is partly responsible, the more common reason is low mental health literacy, low prioritization of our mental health needs, and understanding of its importance in our well-being. There are no platforms where we are formally schooled in how to recognize and manage painful or difficult emotional states. Most of us learn passively from our parents, who may not always have been the best role models. And expressing emotional distress is still viewed as a sign of weakness in a society that still prizes IQ over EQ. And our training of healthcare workers is still very much a linear and biomedically focused approach. The pandemic is not just a biological threat on every one of us. It has also shaken us at the level of our very hearts and souls. And these are terrains that many of us avoid, deny, or have great difficulty navigating. The pandemic has exposed our vulnerability at all these levels. And the tsunami of distress and stress has been coupled with restrictions on our access to traditional support systems. Lockdown did restrict our traveling, but we could and we needed to travel inward. And unfortunately, that is a journey not many people take or even like. It is often easier to pop a pill or take a vaccine than to learn how to care for and love ourselves. And Dr. Milligan is going to tell us more about how to do that. So a platform like the Healthcare Workers Network is there to promote awareness of the need for holistic self-care, body, mind, heart, and soul. And lastly, I just want to emphasize that mental well-being is central to physical well-being. I'm going to share one example of this mind-body connection that is pertinent to the pandemic. There is much anxiety and impatience for all of us to get the vaccine so that we can acquire biological immunity. However, studies have shown a 97% difference in antibody levels between those who are allowed to sleep on the night they received the vaccine, a hepatitis B vaccine, compared to those who were kept awake. Similarly, over a 6-month period, every additional hour of sleep in hepatitis B vaccine recipients translated into a 56% increase in antibody levels. Now, emotional disturbances commonly manifest with sleep disturbances. So, for the biological immunity that we all need to protect us against COVID-19, psychological health is equally important. So, I urge all to let us start building our resilience and building psychological immunity. Thank you very much, Bonga.
Sure. Thank you so much, Severa. It's really heartening that there's so much has happened and so much effort has gone into trying to support our frontline workers, and we really appreciate it. And it will be good perhaps during the Q&A to try and take this further to ask a little bit more about why is the uptake so low when indeed there is a huge need for this. And we can discuss that perhaps. Colleagues and participants, if you could start typing in your questions in the Q&A answer session. So I'd like to move on now to Dr. Milligan. Pete, if you may take us through a little bit about what we can do as individuals that are working in the system. And we know that it's very challenging to work in our healthcare system in this country. And we obviously don't want to say to people that they must throw in the towel, the system needs to change, but I think we also need to think a little bit about what it is that we can do as individuals that are working in the healthcare system. Thanks, Peter.
Well, thanks, Prof. And thanks to colleagues at UKZN for putting the webinar together, and greetings to all our participants. Thank you for taking the time to join us. Yeah, I think Prof has teed this up nicely by pointing out that we work already in very stressful environments. So this isn't just about individual resilience and the type of things that I'm going to be talking about in the next 10 minutes. It's also about systems change and systems improvement. So really important that we look at this as well as look at how we protect ourselves going forward. So I think in thinking about individual resilience and how we prevent burnout for ourselves, I'm going to start with something that might seem very obvious. And that's that we need to take the time to give ourselves permission to care for ourselves. I think very often we as health workers are caught up in the treadmill of our daily work. Many of us work in environments where the needs significantly outweigh the resources. And we get on this treadmill of working harder and harder. And also because most of us have gone into medicine or healthcare because we really want to help others, we do this at our own expense. So the first thing I want to encourage you to do today is just to allow yourself or give yourself permission to take care of yourself. Because if you don't do that, that's where the trouble starts, because it's not going to happen if you don't allow it to happen, and if you don't give yourself the space and time for self-care that we all so desperately need. And there are a couple of key words that I like in talking about this. The first is empathy. So empathy in simple terms is really just feeling with. And we teach our medical students to empathize or to feel with our patients. Another word we like to use in healthcare is compassion. And the definition of compassion that I like is feeling with and acting on behalf of. So it's almost empathy plus. So it's not just feeling with the other person, but it's thinking about what would help them, what would be the next best step that might assist them along the way. And again, we teach our students to do this for our patients. But this afternoon, I really want to encourage us to engage in self-empathy and self-compassion. So self-empathy, feeling with ourselves, and I'll talk a little bit more about that now. And self-compassion, feeling with yourself and then learning to act on behalf of yourself and saying, well, what's the next best thing for me in this situation or at this moment? So I'm going to encourage you all to develop your own anti-stress toolkit. And while there may be certain generic tools that we all like to keep in our toolbox that are similar, each of us is different, and each of us already knows to a large extent what are the things that we enjoy, what works for us. You know, not all of us are big runners, but for some of us who are athletic, running or exercise in any form is hugely helpful. But I don't think we can define the same tools for every individual. So I want to encourage you, having given yourself permission, to develop your own toolkit. And I'm going to go on and suggest what you might consider including in your stress toolkit for dealing with stress and burnout. So some of these are the very general physical aspects. I've mentioned exercise already. Prof. Ramlal's talked about the importance of rest and sleep. Healthy and beneficial eating is crucial. One of the big challenges during the pandemic has been the distancing or the social and emotional disconnection that's happened. And particularly again, as health workers working long overtime hours, we so easily become disconnected. So working deliberately to maintain meaningful social connections with others is a key element in reducing stress and burnout. The third broad areas are mental components, so things like learning and reading, writing, teaching, all of those things are helpful. And then there are the broader spiritual aspects, and I mean this in a really broad sense. So things like spending time in nature, perhaps expanding your spiritual self through meditation or art or music or prayer or meaningful service. So those are some broader issues. Coming more specifically to how we encourage self-empathy or self-awareness, first of all, any basic body awareness practice is useful. So in our mindfulness teaching, we teach a simple body scan exercise. That can be very helpful, and you can pick up much of these things online. Those of you who are yoga practitioners will know that yoga and other forms of mindful movement give us a tremendous sense of body awareness. And remember that it's the body that keeps the score for us emotionally. So the more we're aware of ourselves physically, the more we're able to stay in touch with where we are mentally and with what's happening. Then turning to mind awareness, they're the broader practices of meditation or mindfulness, which is much spoken of these days. And there are many, many possible ways to approach this. The first would be the standard mindfulness-based stress reduction programs. These are now offered all around the country by a range of trained practitioners. It's an 8-week course run over about 2 hours a week with home practice in between. And this in various shapes and forms is now widely available. You go onto the Institute for Mindfulness of South Africa, that's the MISA website, you can pick up access to MBSR training in your area. And of course, with lockdown and COVID, a lot of this has moved online. So there's a huge array now of online mindfulness courses, some of which are generic, some of which are geared specifically to health workers. And you're welcome to contact me if you'd like to know more about some of the details of these. And then, of course, again, there are a wealth of mindfulness apps that are available that are very helpful to have on your phone and that provide short mindfulness exercises that you can use during the day. But mind awareness isn't just about meditation and mindfulness. It's also sometimes about psychotherapy. So just a reminder that, as Prof. Ramland has said, that if you are really struggling, it's important to get hold of a mental health professional, clinical psychologist, psychiatrist, or other trained psychotherapist for psychotherapy, particularly if you've suffered significant trauma or have a history of serious trauma. So psychotherapy is an important part in dealing with burnout. Then there are a number of very simple daily exercises, a bit like brushing your teeth, that you can use. So these are things like regulated breathing. Again, there are a number of apps available that can help you with that. And then there's simple mindfulness tools like the 3-minute breathing space or the stop practice, that's STOP. Again, if you just Google any of these, you can pick them up. And they're very helpful because if you can, again, find a moment to pause in your day, they can just help you refocus and provide you with a sense of groundedness and a way forward in a very stressful environment. And then there are, of course, a whole range of self-soothing exercises. So we all naturally self-soothe in various ways, and really we do this using the senses. So we self-soothe in visual ways. We might go for a walk in nature or look at something beautiful, maybe watch a movie. We self-soothe orally with music very often, or other oral stimuli, and likewise with smell or taste or touch. And again, this works differently for different people, but different self-soothing practices can be really, really helpful. And you will know which of these will work best for you. So I really want to encourage each of you to actively design your own stress toolkit and then to take time to practice these things so that you protect yourself going forward. I do just want to say that one of the problems of stress and burnout is that we may self-soothe in maladaptive ways. We all do this to a certain extent. We've had a tough day. We get home, we open the fridge, and we eat whatever we can find. That's one very obvious, perhaps maladaptive way of self-soothing. But sometimes this can become a problem, and in fact, it can become an addiction. So I do just want to warn you that this can be an issue, and that it's important to identify these maladaptive behaviors, and then without judging yourself, because we all self-soothe in different ways, look to replace these maladaptive behaviors with more healthy behaviors. And if you are struggling with addiction, to seek help. And once again, there are many, many resources available online and otherwise to help you with addiction. But addiction in health workers is a big issue. And I think addiction may have become a bigger issue during the pandemic as people have sought to self-soothe to try and get themselves through. So in conclusion, somebody said you can't pour from an empty cup. And that's true. So self-care is really fundamental to our professional responsibility, because if our cup is empty, we can't give to our patients or to our families. So at the core of our professional responsibility is this self-care. So self-care is not selfish. So take time to care for yourself. It's important. Thank you.
Yeah, thank you so much, Peter. This is really very useful. And I just wanted to ask you about something. So you spoke a little bit about some of the spiritual practices that are also quite useful for us to take care of ourselves. And you said that you shied away, I think, from religion. And I just wanted to ask you if you thought that going to church and singing and having praise and worship and those kinds of things that some of us grew up doing, would that also be part of that gambit of things that one can do to take care of ourselves?
Yes, I think it is, although of course, Prof, we must acknowledge that during lockdown that's been curtailed as well. So, I mean, that's part of the social disconnectedness. Many of us have found our identity and solace within our own religious groupings and practices. And so I think the challenge for many of us has been finding ways of doing that outside of the church or the mosque or the place of worship that we would normally have been to. And all religious traditions contain elements of these reflective practices that I've been talking about. So absolutely, I think that these mainstream and other religious practices are really important at this time. Thanks for raising that.
Thank you. So thank you very much. So I think it's time for us to open up for discussion from participants. And we'll start perhaps with you, Seda. The first question is from Lungelani Sibiya. And Lungelani would like to know a little bit more about signs and symptoms that will make someone realize that they are suffering from burnout.
So burnout is a little bit different from depression or anxiety. It's more in relation to your job. And therefore, one would generally have feelings of just being emotionally exhausted, tired, very negative towards your work, really not feeling motivated about it initially. Sometimes losing interest in work, dreading work. Often people who feel burnt out are thinking of resigning, quitting. And sometimes this was your passion. This was what you wanted to be always. And now when you're in that situation, because of the context of your work-related stresses, you're feeling that you cannot cope and you want to leave this environment. So generally, people who feel burnt out will score very high on exhaustion scales, will score very high on feeling of being negative, irritable with work, not able to communicate with others at work, etc. And your level of feeling happy about work, about having accomplished something at the end of the day, are low. So your self-esteem regarding work is also low. And so generally if you're finding yourself in that kind of a picture, then possibly, one should consider whether you're having symptoms of burnout.
Thanks, Seda. The next question is from a clever doctor that's also for you. And it says that in the ICD-11, that's the WHO classification of diseases, burnout is now included as a psychological syndrome and not a formal diagnosis per se. Do you foresee this happening in the American version of the ICD, so the one that's called the DSM, the Diagnostic Statistical Manual, given the move towards a more dimensional as opposed to a categorical approach of diseases? What is your take on that one?
I must say, I think the person asking the question is cleverer than me, but it's a good question. I agree. So currently, burnout is not classified as a disorder per se. It's a syndrome cluster, which is suggesting vulnerability and suggesting that you need help, but currently did not meet validity and reliability criteria to be diagnosed as a disorder in the DSM-5. I think possibly DSM-6, which may be some years down the line, may consider having this initially maybe in the appendix section, looking at research criteria before it actually becomes a disorder. So I think we're still possibly a bit far from it becoming a disorder, but possibly there'll be, by putting it in the appendix section or in the research criteria to for people to start looking at it more closely, I think would be the first step.
Sure. Dr. Milligan, do you have some thoughts towards that?
Yeah, I think, Prof, like all of these things, the classification systems evolve slowly. And with the DSM-5, there was a lot of criticism about pathologizing normality. And, you know, my view is that we need to be cautious around pathologizing too much. But I do think that if somebody's function is ultimately severely disabled by burnout, then it does need to be classified ultimately, because the problem with it not being given formal diagnostic status in that sense may be that the individual could lose out on care or medical aid insurance or other things going forward. But I think we're still a way off this being formalized, certainly in the DSM.
Sure. Thanks, Peter. And maybe whilst I have you, if you could just explain this to us. One of the things that one has been reading is that the healthcare professions are probably more likely or more at risk for burnout. And some people have kind of spoken a little bit about because of the kind of work that we do, and you know, we are caring for people, and that kind of it requires a lot more emotional sort of perhaps resources to do this. And I was just wondering about what you thought of that, and you know, are all caring professions necessarily more likely to have higher rates of burnout? And also, secondly, I suppose one of the things that newly qualified, particularly young doctors, young nurses, you know, often gets frustrated when they talk to me about they have these ethical dilemmas that are really problematic, and I think COVID is a very good example of that. It's so in the textbooks it says, you know, I must give this patient this kind of care or this kind of medications, and yet they're not available. And I would imagine those kind of ethical dilemmas would also perhaps more likely to lead to people to be burnt out. Can you just maybe break it down for us a little bit more?
Yeah, thanks for that, Prof. I think you're absolutely right. I mean, in response to the first, I think there's lots of evidence that health workers suffer from high levels of stress, burnout, and in fact, suicide is quite significant. Somebody put it very well. They said, you can't immerse yourself in a sea of suffering and not be affected by it. And that's where we are. And we've seen this escalate during COVID, you know, watching young doctors going to the COVID wards, nurses being on the COVID wards with all the unknowns and all the anxiety, particularly early on in the pandemic, was tremendously stressful. So absolutely agree that we as health workers are more vulnerable and are needing more help. The second issue that you raise is very interesting because what we haven't spoken of, but which I think is an important part of this discussion, is the whole principle or concept of moral injury. And moral injury really refers to a situation where one's forced, like you say, to make difficult choices. So do I go onto the COVID ward knowing that I haven't quite got the right PPE? Am I going to put myself at risk? Or am I going to leave the patients unattended to? And I think the pandemic has thrown up a number of these moral dilemmas. Who's going to get the next ventilator of the patients who is rapidly deteriorating when there's only one more ventilator available? How am I going to distribute scarce resources when the resources don't meet the needs? And particularly, I think, for junior staff being thrust into this and often thrust in quite unprepared, I think this adds enormously to their stress. Because let's face it, most of us coming to medicine are real idealists. We really want to help people, and that's why we did this job. And suddenly we're thrust into the trenches, and things are really, really hard. So I think we need to acknowledge this and give our staff the space to talk about these experiences. I think there's a burden on us as teachers and trainers, and in fact as managers, to be sensitized to the needs of our health workers in this regard, particularly, as I say, the junior staff.
Thank you very much, Peter. And there's a question for Professor Ramlal Suvira. The question is from Figile. If you may answer, please. It says, in a workplace setting, how can one assist a fellow healthcare worker who displays burnout or depressive symptoms?
Thank you, Bonga, and thank you for that question. I think, we need to, each one of us can take back into our workplaces a compassionate presence, a caring presence, and awareness and formal acknowledgement of our own personal needs for well-being. I think that has been lacking, and it starts and it dates back right to the time when we train our healthcare workers. We do not emphasize enough the need for us to look after ourselves first and foremost. And we aren't providing our students with the skills to be able to take care of their needs in very challenging circumstances, in a very challenging, demanding job, and also under very difficult work conditions. So I think that's the starting point, is that there needs to be this awareness amongst each one of us so that we can have these conversations within our workspaces, that there is no stigma, there is no shame, and that we also make time and space and prioritize looking after ourselves. And I think once we start at that level, it then opens up the way for us to advocate for better resources and better support, better recognition from our employers of the need for us to be supported in terms of our emotional needs and the emotional impact of the jobs that we have, as well as the fact that we have personal problems that also impact on our functioning. So we need to have a more compassionate approach to employer well-being and a holistic approach to employee well-being, where mental health and spiritual support as well are factored into that platform of employee support. So I hope that that answers Fikile's question. As I said, the change begins with us. We need to be the change, and that's the best way we can fight the stigma that's often associated with having mental health or emotional issues. Thanks, Prof.
Thanks, Severa. Whilst I have you on, there's also a question from Tulani that is asking about support available for registrars. These are doctors that are specializing in the different fields of medicine. And Tulani's asking if there are resources available for registrars specifically, and if so, can you please share that with the participants?
So the Healthcare Workers Care Network is open to all, not just medical healthcare practitioners or nurses. It's for all frontline workers. So it has been extended because we also have to acknowledge that the cleaners and the people who serve the food as well during the COVID pandemic are equally at risk and vulnerable. So in terms of registrars specifically, they can access the Healthcare Workers Care Network. There's also the South African Depression and Anxiety Group, which has a variety of resources on their website, as well as toll-free helplines. Within the university, because registrars are registered with the university has a very robust student support services that they can access free online consultations, therapeutic consultations with the counselors and psychologists that the university has employed. And I think within each discipline, there should be a sub-community where, with the assistance of the HOD and or the registrar rep, there is a formal time and space dedicated to looking at the well-being of registrars, because different disciplines are differently impacted by the COVID pandemic. So it's important for us to recognize what the unique factors are during this pandemic and how they impact on specific groups of registrars. And so we could make specific arrangements to support these registrars. So from the university point of view, I also get the I'm the academic leader for the training program, and it's coincidence that I'm also a psychiatrist, but I'm very passionate about mental well-being, and registrars are welcome to contact me. And we have arranged specific sessions for groups of registrars at hospitals or within disciplines in order to address whatever their needs are and see how they can be supported, but also to, in times, to assist with referring registrars who are in need to psychiatrists or clinical psychologists should they need that. So people can contact me through the university, and I'm happy to assist on a personal basis or as a group. Thank you.
Sure. Thank you so much, Severa. Perhaps the last question, because I'm running out of time, even though there's more questions, will be for you, Dr. Milligan. Pete, if you can answer from Kelly Jane Turner, who's from IOL News. She wanted to ask you about how do you think the healthcare system will manage the third wave, and could burnout affect the way healthcare workers handle the third wave? Thank you.
Thanks, Prof. And Kelly, thanks for raising this. Of course, we don't yet know the timing or the dimensions of the third wave, but if we just think back to the second wave, I think what made it so brutal for us here in KZN was not just that the numbers were higher, but that it came right at the end of the year when people were already exhausted. We'd all felt that palpable sense of relief after the first wave. We'd gone out and done our Jerusalemas, and we thought, wow, we're gonna get through this. And then the second wave hit, and man, it was brutal. And leave was cancelled, and people were tired. So I think it really depends on the timing and extent of the third wave. We don't yet know what's going to happen. So it's hard to answer that, but there's no question that just like repeated trauma has consequences, so repeated stress in this way has consequences. Perhaps each time we're a little bit better prepared. We're certainly, as a Department of Health, each time I think a little bit better resourced. And in that sense, perhaps we're a little bit more ready. But I think that we need to keep up the work in terms of mental preparedness, because often the focus goes into, again, physical healthcare stuff, and working around prevention in terms of burnout and distress is really important. But I wish, like you, that I knew if and when and how big that third wave would be.
Yeah, so unfortunately we've run out of time, and I just wanted to say thank you so much to our three panelists, Dr. Milligan, Professor Ramlal, and Dr. Paruk, so much for your insights. And I hope the people that attended learned a lot about these things. And I think I hope that from now on we will actually encourage young nurses, doctors, OTs, physiotherapists to do the right kind of caring for themselves, and not to binge on food and whatever's in the fridge, but to actually take a lot more mindfulness approach to caring for themselves. And hopefully that way we will definitely try and decrease the rates of burnout, depression, anxiety in our people in KZN. So thank you so much, colleagues, for agreeing to do this. And thank you so much for the panelists and the participants and UKZN for organizing the seminar. Take good care.